Hi, I'm Dr. Anna Kundel. I'm a medical director of endocrine surgery at Valley Medical Group, and I'm here to talk about thyroid nodules. Thyroid nodules are masses or lumps in the thyroid gland. Anyone can get them, any age group, both men and women. But women get them much more often, and they're more common as we age. About 60% of women over 60 will have a thyroid nodule. Well, one of the risk factors that we know about is iodine deficiency, but that is actually extremely rare in the United States because we really get it all the time in our diet. Another risk factor is an autoimmune disease of the thyroid called Hashimoto's thyroiditis. Other risk factors is family history and radiation to the head or neck that usually happens about 10 years prior or in childhood. Majority of the nodules are found incidentally on imaging unrelated to thyroid. You would have an image for something else, and a thyroid nodule is found incidentally or by accident. Majority of them are asymptomatic, as most people don't even know they have a thyroid nodule. Sometimes if the nodules are large, they can be identified on physical exam by the patient themselves or by a physician. If they're large enough, because the thyroid sits on the breathing tube or the trachea and next to the swallowing tube or the esophagus, some patients may have symptoms of compression, such as difficulty breathing, difficulty swallowing, pressure, pain in the neck. Well, the best way to evaluate a thyroid nodule is with an ultrasound and thyroid function test done on blood work. Sometimes patients may need a fine needle aspiration. This is an office procedure that is done using a very thin needle, thinner than we use for blood draw, to collect cells from the thyroid nodule. And that is done under ultrasound guidance. Depending on the results of the biopsy, your multidisciplinary team that usually comprises of endocrinologists, cytologists, radiologists, and thyroid surgeon will recommend the best management for you. Well, the good news is most of the nodules are benign, but sometimes we would recommend surgery. If the biopsy result shows cancerous cells in the thyroid nodule, at that point it's very important to seek an experienced thyroid surgeon. It is likely that the surgeon will then offer you an operation. It may be a total thyroidectomy, meaning removing your entire thyroid, a hemithyroidectomy, or a partial thyroidectomy, meaning removing only part of your thyroid. Sometimes, if the biopsy result is indeterminate, meaning it is difficult to identify whether the nodule is benign or cancerous, a surgeon may offer you a diagnostic lobectomy, which means removing part of the thyroid with the thyroid nodule in question to further make the diagnosis. Sometimes a surgeon may offer you surgery for benign nodules, specifically if the thyroid is enlarged and causing compressive symptoms. So some takeaway points. Thyroid nodules are common. Most of the time they are asymptomatic and will not cause you any trouble. Some of them may need a biopsy. If the biopsy shows cancerous cells, indeterminate cells, or the thyroid nodule is causing compressive symptoms, you may need surgery. At that point, it's best to seek advice of an experienced thyroid surgeon and a multidisciplinary thyroid team to make sure you have the best care possible. Thank you for watching.